Hello everyone, this is Paul Horvath. I am coming to you representing your OSL Health Ministry Committee. As you know, last year we were able to start a monthly education series highlighting speakers from around the community to address various health and wellness related topics. That was very successful. We hope you all enjoyed that and are grateful for the feedback you were able to give us. We look forward to continuing that this year. Obviously, since we are not doing in-person church services right now, we will continue that by a virtual method. This month, we are happy to welcome Drs. Adam and Andrea Miller, who are both family physicians at Mayo Clinic Health System here in Menomonie. They will be talking to us about adult immunizations. Next month, we look forward to hearing from Drs. Mark and Sarah Chambers, who are dentists here in our community, coming to talk to us about National Dental Hygiene Month. With that, welcome Drs. Adam and Andrea, and please post your comments below. Before I pass it over to them, Adam did send me a message after they recorded this. He thinks he misspoke on one point about the shingles vaccine, and just wanted to make sure that it was clear that that is actually a 3-shot series. Otherwise, enjoy their presentation, and thank you for any feedback.
Hello, everyone. We are the Millers. My name is Dr. Andrea Miller, and this is my husband, Adam Miller. We're both family physicians at Mayo Clinic here in Menomonie, and we've been asked to talk a little bit about adult immunizations, risk, benefits, timing of immunizations, and certainly important things, who pays for what. We're going to start out by talking about immunizations that we feel are important for adults. We're going to start out with the pneumonia vaccination.
The pneumonia vaccination, I believe, is one of the more important adult vaccines for people to get. It protects against the most common bacterial cause of pneumonia, which is also the most common cause of bacterial meningitis in adults. A very common cause of sinus infections, as well as ear infections as well. It's recommended that everyone over age 65 gets 1 dosage of this. It is typically covered by Medicare and any other insurance companies. There are some certain individuals that should get vaccinated before age 65 one time in their adult life. That would be anyone with any lung disease like asthma or COPD. Also, other high-risk people should be immunized before age 65, including those with diabetes, kidney disease, any sort of active cancers, anyone on chemotherapy, or anyone that is considered immunosuppressed, such as people on medications for like rheumatoid arthritis and other sort of autoimmune sorts of conditions. Andrea, you want to take the next one?
Yeah, the next one is the influenza vaccine. Influenza season is right around the corner, and you may have already seen some promotions from local pharmacies about getting your flu shot. Influenza comes in 2 main strains, type A and type B. And then the influenza vaccine that is offered to most adults covers both of these strains. If you are 65 or older, there will be a high dose vaccine. This gives you additional immune protection. There has been some controversy about the timing of the vaccine, and what we're seeing is that traditionally we think that the immunity from the flu vaccine lasts about 6 months. And so, yeah, from the standpoint of when to get immunized, early fall, come October and early November is probably a good time frame so that it lasts throughout the remaining of the season. If you have already gotten your flu shot, don't worry, it will be to your benefit. But certainly if you're questioning about when to get it, sometime in October would be best. If you are pregnant or are soon to deliver, the immunization is very, very important. It takes about 2 weeks to gather some immunity. So if you are close to the time of delivery, you're going to want to get that flu shot as soon as possible. This can then protect your unborn child from the flu shot, as newborns are unable to get the flu vaccine until about 6 months of age. There is also some controversy about whether or not you can get sick from the flu shot. This is certainly a concern. We don't want you to feel ill from a flu vaccine, but the flu vaccine that we offer currently is not a live virus vaccine. So you cannot get influenza from the vaccine. Some people may note some side effects of feeling achy, perhaps some low-grade fevers, but these seem to be somewhat subjective based on the person that gets the vaccine. More importantly, yes, you can get influenza still if you have had the vaccine, but the vaccine has been shown to decrease the chance of death from influenza. It has also been proven to show that even if you get influenza and you have had the vaccine, your duration of hospitalization is oftentimes less, and your risk of needing ICU or intensive care is also less if you've had the vaccine in comparison to those that are hospitalized and have not had the vaccine. The other good thing about this is that Medicare will pay for the flu vaccine each season. Each season, the flu vaccine does change, and so it's important, even if you had the flu shot last year, to get an updated one each fall. The next one that we're going to talk about is the tetanus vaccine. There are a couple different forms of the tetanus vaccine. There is one that is TD and another one that is Tdap or TDAP. The AP component of this immunization is the adult pertussis component. And if you are an individual that has not received a Tdap in adulthood, your next tetanus shot should include the pertussis component. The immunization is updated every 10 years. And typically, if you had the Tdap, then the next time that you are due, you will receive just the TD. Medicare Medicare Part A and B do not pay for the tetanus vaccine, but Part D will pay for the tetanus vaccine. Also, if you have had an exposure, an open wound, a cut, something along these lines, an animal bite, Medicare will pay for a TD in the setting of an exposure or increased risk. Another thing for adults that are pregnant, a Tdap is very important, as that pertussis component will transfer to the growing baby, and you will receive a Tdap with each pregnancy, despite the timing in between. Even if you had one with your last pregnancy, you will have another one with each individual pregnancy. Adam?
Okay, the next vaccine we're going to be talking about is the shingles vaccine. Shingles is something that is caused by reactivation of the chickenpox virus in those that have previously had chickenpox in their life. A person can also get shingles from simply having had the chickenpox vaccine earlier in life. The chickenpox vaccine is a live virus that sort of is a milder form of the same virus that in some people can reactivate and cause shingles. Typically, if shingles is caused by a reactivation of the chickenpox vaccine, it's much more mild than if it's caused by reactivation of somebody that was exposed to and had full-blown chickenpox in the past. Now, what is shingles? Shingles is typically a very painful rash. It spreads in a certain pattern based on what part of the body it's on. It typically follows the distribution of some of the sensory nerves. And And the way it looks like a group of red blisters. Usually pain starts a few days before the rash shows up, so it can be really confusing and hard to figure out what is going on early on in the stages of a shingles outbreak. Now, we do have some pretty good medicines nowadays to treat against shingles. There are some antiviral medications in the form of pills. And if somebody gets shingles, it's very important that they start these medications early to reduce risk of complications that can sometimes be chronic and long-term. So considering the fact that shingles can cause such a painful rash and sometimes some long-term complications, this is what led to the development and research involved in producing an adequate shingles vaccine, because it does affect a lot of people and can cause a lot of problems. There used to be an older shingles vaccine called the Zostavax vaccine. That was a 3-part series. It was a live virus. A lot of you probably have had that vaccine earlier in life, maybe within the last 20 years or so. That vaccine has recently been replaced by a newer, much more effective vaccine called the Shingrix vaccine, which has much higher effectiveness. And those people that previously were vaccinated with the old Zostavax are recommended to be re-immunized with the newer Shingrix vaccine. The new Shingrix vaccine is recommended by everybody age 50 or older. It is a 2-dosage vaccine. The first dose is given pretty much any time after age 50, and the second dose is given 2 to 6 months after the first dose. It's considered to be a very good vaccine with very good protection and much more effective than the older Zostavax vaccine. Now, the downfall of this vaccine is that it can be quite expensive, and depending on where you get the vaccine, a person's drug plan may or may not cover it. For example, it may be covered in the clinic or in the pharmacy setting, but not in the clinic setting. And Medicare does not typically cover this vaccine. So what we typically recommend to our patients is to check with their insurance company or any Medicare supplement plan that they have to see if they cover this vaccine prior to getting it, because it can be quite expensive. And if you don't get it due to financial reasons, like I said, we do have very good antiviral medications to treat shingles if you end up getting it. The importance is early identification of shingles so you can get treated right away if you get it. So that's what you need to know about the new shingles vaccine. A couple other vaccines that we wanted to touch bases on before wrapping up our talk are the hepatitis vaccines. There are 2 separate vaccines for hepatitis. Each one targets a different strain of the hepatitis virus. The first one is the hepatitis A vaccine, and the second one is the hepatitis B vaccine. Hepatitis A vaccination nowadays is something that's routinely done for small children. All of us adults probably didn't routinely get immunized with hepatitis A when we were children because it wasn't recommended then for children. It's not necessarily recommended for all adults if you haven't been vaccinated before. It's typically recommended for those who are traveling internationally to areas that might have poor water or sanitation, as hepatitis A is typically contracted through contaminated water type of supplies and sometimes even contaminated food products. There are some other people that are recommended to have routine hepatitis A vaccine. That would be anybody with any underlying liver disease to begin with. Hepatitis A is a 2 dosage vaccine series, and typically it's well tolerated without any major side effects, and it is typically covered by commercial insurance. The other hepatitis vaccine, the hepatitis B vaccine, is a 3-part series. That's not necessarily recommended to all adults either. It is typically recommended to all healthcare workers and anybody that may be exposed to any high-risk people or bodily fluids with the type of occupation that they do. Other people recommended to get the hepatitis B vaccine would be anyone with any underlying liver disease as well. Now, kids these days, just like the hepatitis A vaccine, are typically immunized with the hepatitis B series. But even when those of us that are young adults were children, it was not routinely recommended. Sometimes there is a booster shot that can be needed for the hepatitis B vaccine. If a person is recommended to get the hepatitis B series, oftentimes there's an antibody titer that might be drawn to see if a person had adequate immunity, and if not, then there's an additional shot that can be given to help boost that immunity. That pretty much sums it up for what you need to know about adult vaccines. Do you have anything else to add on any of those?
Certainly, if you guys have questions or are interested in finding out more information, you can touch base with us when church is back in service, or certainly contact our staff at the church. You can also send a message or give a phone call to your own primary care provider for more specific recommendations on your own health conditions and what immunizations would be recommended. It was nice sharing this information. We look forward to helping serve our community here in the future.